The surgical world in general is moving toward an outpatient scenario. Patients want to be in an outpatient setting if possible because they do want to go home. And as techniques advance and as anesthesia has advanced, we're able to provide a much higher level of care in an outpatient setting than was traditionally thought of as reasonable. I wanted to really look into that and explore it, and I elected to build a surgery center now called Arrowhead Surgery Center here in Duluth. Our focus is going to be minimally invasive spine surgery with maximal technology available.
Arrowhead Surgery Center has 2 ORs and 1 procedure room. One is 750 square feet, the other is 675 square feet. We've got 4 pre-op bays, we've got 5 post-op bays, and we've also designed the space to be forward-thinking to the point where if and when we're ready to grow, we've got that space to add 2 additional ORs in the future. So from the time you leave your car, walking through the lobby, getting to our space, checking in, pre-op, operating room, post-op, and then discharged through a separate private door, it's all built around that patient experience, making it as comfortable as possible for the patients. From an implant perspective, from a technology perspective, Stryker had those things that others didn't and could provide. It put me at ease as we continued on in the process, to the point where when we finally made our decision, there really wasn't a doubt in my mind. I didn't know that they had the ASC sales rep that could help bring all of that together, the implementation manager who could be that person working behind the scenes at Stryker, getting all of the pertinent information assembled in a way that I could consume it, I could understand it. I didn't need to go to 4 or 5 or 6 different people. They had those people that were there put in place to help us succeed.
Stryker really stood out as we were looking to build out Arrowhead Surgery Center. They really have dialed in their ASC division to really be able to help someone like me understand what technologies are out there and what are needed for the build out. Additionally, their product line is phenomenal. The technology continues to advance. Their implants are excellent, and I was particularly intrigued with the Arrow. The Stryker Arrow was important to me because it is an actual CT scanner that allows me to get really precise imaging in the operating room, real time, that subsequently will meld with the navigation platform and will provide such good image quality. My advice to a fellow surgeon who's looking to open an ASC is to do it. I mean, now's the time. The ambulatory surgery centers are growing in popularity, and there are resources out there like this partnership that Arrowhead has established with Stryker that can help to ensure that you are going to get the center built out, and then, of course, hopefully are successful. We're early on. We're about to open our doors, so the success piece will come later, but we've got all the tools in place to make sure that happens.
For a new surgery center that's starting up, it's so important to establish your brand and your identity. And from my perspective, when we were starting out, the opportunity to co-market, to co-brand with somebody like Stryker, it was a huge opportunity, given the fact that Stryker is an international brand, solid values, solid reputation. For us, it just magnifies what we're trying to build here.